My name's Annie Dixon, and I'm going to be doing my integrated practice project on reducing the spread of infection in the operating room. So I wanted to focus on reducing surgical site infection because while being a circulator in the operating room, we always have to make sure that we are, following sterile technique and practicing asepsis, and that's a really big deal in reducing the risk of infection for patients. So my goal was to design a PowerPoint explaining the importance of sterile technique while working in the operating room. I included important data pertaining to the significance of reducing the spread of infection by maintaining asepsis and maximizing the optimal care provided to the patient. I obtained data relating to the infection rate presented by patients during post-op care in the operating room that I work in. So by the end of Module 1, I wanted to make sure that I found 5 current evidence-based practice articles on the importance of sterile technique in the operating room, and I wanted to use that while presenting my PowerPoint presentation, which I did. By the end of Module 2, I presented information that I had obtained within the unit that I'm working in that related to my project, and I contacted my project site contact, which is my supervisor. And we talked about different things that I could do my project on and things that I could discuss with the staff and teach them about that would overall help with, working in the unit and, providing better patient care. And so that's why we just came up with reducing surgical site infection, because that's very important in working in the operating room. Making sure we, keep a sterile field and nobody turns their back towards the sterile field, and making sure that we provide education and everybody has to make sure that they, have all the information that they need to know how to properly take care of patients. So by the end of Module 2, I presented the information, and by the end of Module 3, I wanted to make sure that I provided optimal patient care by explaining to the staff the importance of working together while presenting my topic and explaining how infections can change the overall health of the patient, which in turn can affect not only them, but also family members, along with other healthcare professionals that are going to be caring for the patient. By the end of Module 4, I made sure to present the data obtained reflecting on the percentage of infection rates that are presented by the patients while in the post-operative setting. And at the beginning, before I did the presentation, our infection rates in the operating room were under 5%. And after I did another calculation, it was actually under 2. And it was like within like a 3-week, time frame. So I felt like, the data that I presented was actually helpful. By the end of Module 5, I wanted to improve the quality of care that was performed in the unit by not only presenting this presentation to the staff, but also by providing important information that's easy to read and related to the audience in order to keep the audience interested, because you want to make sure that the listeners are interested in what you're talking about, because if they're not and they get bored, they're less likely to understand and get what we're talking about. By the end of Module 6, I analyzed the overall percentages of infection rates, which I just talked about, that were collected after the presentation, and I also got an evaluation of the learners, the audience that I presented it to, by giving post-op, pre-op, and post-op questions. And the first question was, what is the average cost per year for surgical site infections, which I, talked about. I hadn't talked about yet, but it was in my PowerPoint. And the right answer was $7.4 billion. And my other question was, are surgical site infections preventable? Of course. So when my 5 listeners of my audience, when they answered the questions, only 2 out of the 5 got them right. But by the end, after I had done my presentation, all 5 had gotten both of the questions right. So I felt like it was real helpful and everybody got a lot out of it. In my journal, I made sure to talk about, the importance of implementing sterile technique while working in the operating room and the benefits of it to, decreasing the spread of infection and It helps in the overall making sure the patient's receiving optimal care. It decreases hospital stays and decreases the amount of antibiotics that the patient's going to have to take, and it just helps with their overall care. And it really helps when providing positive overall outcomes, because you want to make sure the patient's better than they were before they came in there. So that's what my presentation was on. I felt like it was really helpful. If anybody has any questions, let me know. Thank you very much.